Hello, and thank you for giving your time to review some significant changes to the ABCD assessment tool from the 2017 Global Initiative for Chronic Obstructive Lung Disease report, also known as GOLD 2017. GOLD has issued reports with management recommendations for patients with chronic obstructive pulmonary lung disease since 2001. A major goal of the most recent report was to incorporate some recent new literature in a way that simplified patient assessment and treatment decisions for the practicing clinician. Significant changes in the 2017 GOLD report include a revision to the definition of COPD, revision of the ABCD category assessment tool, new evidence on disease management, and strategies for managing important comorbidities. In this video, our objective is to review how patients are categorized using the ABCD tool. In the 2011 GOLD report, the multimodality ABCD assessment tool was introduced. This incorporated measures of COPD symptoms and future risk. Clinicians found the ABCD tool confusing to use because both exacerbation history and spirometry were included in assessment of risk. Subsequently, researchers found the ABCD tool performed no better than spirometry alone for mortality prediction or other serious health outcomes. Therefore, in the 2017 GOLD report, the ABCD assessment tool has been refined to include only respiratory symptoms and exacerbations when assigning patients to the different categories. The ABCD assessment tool is helpful when choosing appropriate therapies for patients with COPD as well. Let's examine these components more closely. Respiratory symptoms are measured using one of two scales: the COPD Assessment Test, or CAT, or the Modified British Medical Research Council Dyspnea Score, or MMRC. The GOLD report prefers the CAT over the MMRC because it assesses multiple symptoms, whereas the MMRC simply assesses breathlessness. A patient with a CAT score less than 10 or an MMRC score less than 2 is classified in one of the low symptom groups, either A or C. Risk is now measured solely based upon COPD exacerbations. A patient with one exacerbation per year is classified as low risk, while 2 or more exacerbations lead to a high-risk classification. A patient can also be considered high risk for any single exacerbation that leads to a hospital admission, even if that's their only exacerbation for the year. The ABCD groups also allow for specific recommendations on pharmacotherapy and non-pharmacologic management. See the full GOLD 2017 report for these and other helpful details in the management of patients with chronic obstructive pulmonary disease.